And welcome back to Martino TV. Because it works so well, Botox has become incredibly popular. You can get it almost anywhere, though. You have to be careful because even some hair salons are offering Botox injections. So you don't want to risk your health to get rid of your wrinkles. Use a medical doctor who tops that list.
I want that.
Yeah, you think so? Yeah, absolutely. Botox injectors, you know, one of the top 1% is right here in Denver. We have Dr. Tahl Humes, founder of Vitahl Medical Aesthetics Spa in Cherry Creek North.
And we should mention she is a medical doctor. And so, you've been a doctor for quite some time.
And you don't just do Botox, you do a whole wide range at your medical
And that's
spa.
important because Botox is not the only thing, is it?
No, it's not. I mean, we do everything. We have lasers to treat the skin. We do Botox. We do dermal fillers such as Juvederm. We can kind of treat the whole gamut of anti-aging procedures.
First, just explain quickly Botox. What does it do?
Botox is a botulinum toxin. What it does is it weakens the muscle so you can't make the wrinkles.
So you can't do all the squinting and stuff.
Exactly.
And then does it reduce
you can still move your face.
Right.
But your skin's not going to fold in where your muscles are moving to make those wrinkles.
And does it reduce those wrinkles?
It does. Absolutely.
And smooths out the skin. Okay.
I have friends who swear by it, especially for up here in the forehead. Now, I have a question about Botox. I've heard like there's a general rule of thumb that you want to stay above the eyes and not go below. Is that accurate, or can you go all over the face on Botox?
You can go all over the face, but you have to be trained in advanced techniques, and you have to know how much you can put. You're going to put a lot more Botox above the eyebrows than you are going to be doing around the mouth, or, well, in the neck you can do it as well, and you're going to be using more there. So you can use it all over. We actually use it also for hyperhidrosis, which is excessive sweating, and you can use it for excess oil in the skin. So there's a lot of different uses for Botox cosmetically. But, you know, initially they used to say, okay, Botox above, you know, Restylane or Juvederm below.
I want to remind people, your name is Tahl Humes, Dr. Tahl Humes, and Vitahl is the website, because when we say it, people may not know. So it's VITAHL.com, Vitahl. It's vitality and your name put together, Vitahl.
Exactly. A girlfriend of mine came up with it.
Very clever. Now, can you explain these fillers? Because this is a big thing. People lose volume. And we can see your beautiful suite here where people can go. We can explain what we're seeing here first.
This is our relaxation room, or our chill room. This is one of our estheticians getting ready to do a microdermabrasion, which helps exfoliate the skin. It's a good step into anti-aging for younger skin.
Does it renew the skin on the surface?
Microdermabrasion, it's a good start, and it's a good adjunct to other therapies. As far as sometimes you'll hear that it is, you know, the end-all be-all out there, but I think it's a good adjunct to other treatments like lasers and injectables.
How often can you do this? I mean, I know that your skin keeps producing new skin.
Right.
So, but wouldn't it become, I guess, dangerous? You do it too often, peeling and scraping.
You really can't do it too often. I would say, you know, as far as a microdermabrasion, you wouldn't want to do more than once every week or 2 weeks, but it's not going that aggressive. We have more aggressive lasers that you would never want to do more than once a month.
Now, if you want to resurface your face because you have some marks and things, are there more aggressive treatments?
Absolutely.
What are they?
So the pearl laser is great. You can do everything from take off the entire top layer of the skin. What you're doing is you're resurfacing that top layer, helping with pore size, texture, fine lines, brown spots.
Does it come back very new looking?
Oh, absolutely. They call it pearl because you have a nice pearly skin underneath.
That's pretty good. And of course you would want a doctor to do this.
Yes.
And
it's medically supervised. You want to make sure that everything is supervised by a physician.
And you're on staff, you own it, you're there.
Exactly.
You don't just say, okay, do it.
No.
And what about then the fillers? Could you explain this? People lose volume, and a lot of men are starting to want fillers because they're starting to look gaunt. And
they get the laugh line.
So explain that.
Well, what happens is as you age, everyone, men and women, we have fat pads that sit up, and as you age, they actually start to go down with gravity. What happens is you start to get wrinkles. What you can do is use fillers to fill in that volume. There's a lot of different fillers out there. The two that we mainly use are Juvederm and Radiesse. And what you're going to do is you're going to actually fill back in and sort of make new cheekbones or fill into the nasolabial folds. They're all FDA approved for the nasolabial folds, and we're using them on other parts of the face.
And how can you make sure that you're going to shape that correctly and get it balanced on both sides? Is that just from experience?
It's experience, and then it's also that you're seeing the product as you're doing the procedure. So you're seeing where that product is going as you're doing the procedure. There is some swelling, and there's a possibility of bruising around it, and that could, you know, alter what you're doing, so maybe you wouldn't put as much in. But for the most part, what you're seeing right afterwards is what you're getting.
So you're a full-service spa, not just medical treatments, but do you do regular spa things?
We do. We also do facials, microderm chemical peels. We do all skincare, and then in addition, we actually have a plastic surgeon we work with who does plastic surgery.
So and this is is this Microderm?
This is Microdermabrasion. What she's doing there is working on cleaning out the pores as well as helping with exfoliation.
So when they say microderm, they mean micro, just the top very small layer?
There is dermabrasion as well that's going deeper, but that's not something we do. That's more of a surgical procedure.
When you're talking about the pearl laser, I'm just wondering, is that something you need to take a couple of days off for? Because I know that some treatments, your face is really red or you look kind of sunburned, and you might not want to go out and, you know, go to a party the very next day.
I don't think you'd want to go to a party, but it depends. I think everyone's different depending on if they'd want to take time off of work. I go to work like that all the time. I'll work over at the hospital and I'll have a bright red peely face, but not everybody else is willing to do that.
Right.
Can you tell us why somebody watching should go to Vitahl Medical Aesthetic Spa? I mean, and not another spot. I mean, that's really why you're here. You want to let people know you're different.
We are. I mean, I think, number one, we have myself or another physician on staff. We're there regularly. So there is physician oversight. For us, what's really important is the fact that we look and feel like a spa. So you have the comfort, but at the same time, you have the professionalism and the safety of a medical office. So what we've done is try to combine those two aspects.
A blend.
Yes, exactly.
Now, explain to us this top 1% of the injectors. How does that come to be?
We're in the top 1% of Botox injectors based on volume, meaning that we do more Botox than 99% of the people in the country.
Wow.
And that's through the company Allergan that supplies Botox.
And you're in Cherry Creek North?
Yes.
2nd and Steel.
Yeah, between 2nd and 3rd on Steel.
Now, do you take walk-ins?
We do. For the most part, we end up needing appointments.
Okay, so it's good if they call.
Yes.
And you have a special for us?
We do.
Okay.
We are offering $100 off of Juvederm, which is one of our dermal fillers, to help fill in the wrinkles in the nasolabial folds, plump the lips or under the eyes to plump up the cheekbones, as well as 10% off Latisse.
What's Latisse?
Latisse is a new product out by Allergan. It actually helps eyelashes grow thicker, longer, and darker.
Really?
I've seen this. This is really
How is that applied?
You actually apply it with a little, it's in a dropper. You put it on a little brush and apply it on the top of your eyelash at night, and then it transfers to the bottom and helps your eyelashes grow, again, longer, thicker, and darker.
Wow, that's amazing.
That's
303.
the newest, latest, and greatest thing. Everyone seems to be talking about it.
It is great.
388-7380. Also, we will be taking calls, if you have any, for Dr. Hume. We'll be taking calls at 303-771-HELP. But look at this number. If you want to make an appointment with a medical spa that doesn't look like a medical spa but have doctors on staff, it has doctors on staff, 388-7380. And, of course, our number here at the show, as always, 303-771-HELP. We're going to ask her to stick around a few minutes. I'm hoping you can, Doctor.
Yeah, definitely.
And if you can, we may have some questions from people on skin, on your injectables, also on other procedures.
Great. Dr. Tahl Humes, thank you so much. We appreciate it.
It's a pleasure.